we had a surplus of $5.5 trillion, looking for $500 billion. And if you look at the fact that in 8 years during the Bush administration, we went through the $5.5 trillion surplus and ran at least a $3 trillion deficit, over $9 trillion. We're looking for $500 billion over 10 years. Obviously, within the context of what we do and the choices we make, that is clearly affordable. And if we do it, over 500,000 people will gain coverage by 2013, hundreds of thousands more in the next few years. Virginia's economy, 2007, lost billions of dollars because of poor health and shorter lifespans of the uninsured. Will increase productivity, and 123,000 businesses may be eligible for tax credits. That's the benefit of what we're doing, but the important thing to note is that the present course path we're on is unsustainable. Too many people are losing their insurance that already have it. Many people can't get insurance, and our budget situation is not sustainable because of the increased cost in insurance. Thank you. I look forward to Eric's comments and to your questions and comments. Thank you very much.
Congressman Cantor. Congressman Scott, that was 20 seconds per slide.
Thank you very much, and Tom, and I want to thank the Times-Dispatch for hosting us, and all of you for coming out. This is I believe, a tremendous opportunity for us. Am I okay with feedback here? This is a tremendous opportunity, I think, for all of us to really engage in a civil debate. And I know that the issue of health care has been one full of passion throughout the summer. We have all seen on the airwaves and reported in the paper the vehemence and the intensity with which people are approaching this issue. And obviously, health care is an issue that is so personable and personal to every family in this country. No one is exempt. But I do applaud the Times-Dispatch and all of you for coming here because what I think the goal is about this morning is for all of us to gain a better understanding about where we are in terms of the prospects for healthcare reform. You've just heard Bobby lay out in general the position that is being promoted by the majority in the House of Representatives. I'm hopeful I can lay out for you in general the position of the minority, and then maybe we can all learn together to see how it is we get to a point we can bridge the gap in the differences. So I want to start by agreeing with several things that Bobby said. Number one, the current system of healthcare in this country is unsustainable. Both sides in Washington reject the status quo. And for many reasons, and Bobby pointed out many. First of all, there's too many people without insurance at any given time during the year. Second of all, the cost associated with healthcare in this country the cost is going to break the bank. It's going to break the bank for the private payers. It's going to break the bank for the government. And that's why we have got to do something to affect real healthcare reform. So those are some pretty significant similarities, I think, that we both come to the table with, and that means we ought to be able to produce something to affect positive reform. Now, all of us, I believe, want to continue to maintain the quality of health care that most people have in this country, because remember, most people, almost 85% of Americans have health care coverage, okay? And then almost 70% of those people in the country like their coverage. So we are dealing with sort of that as a given. So we do want to maintain the quality of care that most people have. We want to offer that, provide the access to that care for the uninsured. And then we want to keep us on a path of fiscal sustainability. Because as we know, the money doesn't come from thin air. We've got to be able to make sense of it in an economic way that we can continue to have health care proceed and the advances made that we've become used to. So we share the context of the status quo being unacceptable. We share the goals of trying to provide more access for more people while sustaining the level of quality that most people in this country enjoy. Now, where we begin to differ is this. And Bobby's got his copy, and I've got mine. All right? This is half of H.R. 3200. All right? And here's the other half, right here. So this is what you got. And when you look through the bill, there are many areas of differences, I think, that you will hear us talk about. But fundamentally, what's behind the House Democratic approach to health care reform is really twofold. One, it is about what you heard the president on TV yesterday talk about. It is about mandating that people have and provide for health insurance. Okay, and it's similar. The analogy has been given that we should require people to have health care insurance just like we do in most states require people to have car insurance. The problem with that, and it sounds good in concept, the problem with that is that once you mandate that people have something, especially from the federal level, you are necessarily going to bring about the question of what it is that you are mandating. How do individuals, how do businesses comply with that mandate? Now, at the state level, that's where the car insurance is done. And currently, that's where health care mandates exist. But if you are going to mandate from Washington, you necessarily then involve federal policymakers and the entire federal government apparatus in that question of what it is you are mandating. And when we went through, and Bobby's on the Ed and Labor Committee, correct? And I'm on the Ways and Means Committee. Both of us have had an opportunity to vote on this bill already. And remember, not most members of Congress, if they're on those committees, they've all had it. But there are many who don't serve on those committees. The bill was stopped before the August break and didn't make it to the floor. So we're sort of at a standstill right now in the House. Tomorrow, you read the paper this morning, the Senate is moving its version of the bill forward. Again, what we saw demonstrated in the House markups in committee was a real desire to define what acceptable health care means. And what it means would be defined by Washington. That's where we begin to differ, because all of us, going back to where we are the same, we want to provide access to more people. You basically do that by bringing down costs. We also want to maintain the quality that most people in this country have and enjoy. And I don't believe, nor do many in Congress believe, that you do that by having Washington define what acceptable health care benefit is. You do that by providing an even playing field for competition to exist. So here's where the differences really become accentuated. What the President and what Bobby and the Democrats in Congress are proposing is that they believe you bring down costs by promoting competition. We believe that too. But they believe you do that best by having the government serve as a competitor, aka also known as this public option. That somehow we're going to see the government be the one setting the rules about what's an acceptable benefit plan, and the government serving as a competitor under those rules. Now that's where we differ. Just intuitively, I don't think that can make sense. I don't think you're going to see the sustainment of a private insurance system in this country if you have the government do so. And so once that occurs, you see then a shift of people, and there are several independent studies that have been taken, and you will see over a period of 10 years, 100 million people in some studies, which say they'll go off of their private insurers because they won't be allowed to stay on those given this bill, and will go into the government plan. The larger the government plan is,